Module 3, Part 2 of Common Health Problems During Early Childhood. About how to treat ingestion of toxins or overdoses, appendicitis, and autism.
So let's talk about lead poisoning specifically. The textbook mentions that the prevalence in U.S. children between 1 and 5 years of age for lead poisoning is 500,000 kids currently. So lead poisoning is a little bit hard to detect, kind of like anemia. So the toxicity of lead in the blood does block the production of heme or blood cells. So the symptoms are very much like anemia, where it is hard to detect unless tested by blood work. So we may see fatigue or pallor, we may see anorexia or abdominal pain, or we may not notice any symptoms at all in a child that has lead poisoning. So it is hard to detect symptoms. Complications, if not treated, can be quite harmful to the body. It can include behavioral problems. There could be learning difficulties. There are signs and symptoms, again, of anemia in addition to nervous system complications. In the long term, we may see encephalopathy if not treated, or excessively high levels. Seizures can happen, as well as brain damage. So high blood levels of lead will require treatment called chelation therapy. The diagnostic test is the lead test from the blood. Greater than 3.5 micrograms per deciliter does require follow-up. They used to say it was 5 just recently. This has been changed from our textbook last year. So this is a current revision. Now 3.5 is requiring follow-up, as well as a repeat test in about 1 to 3 months. Greater than 15, we must, as nurses, report to the local health department. Local authorities might be sent out for surveillance. So how to get lead poisoning? If a home was built after around 1978, because they used a lot of lead paint in the homes, and children may pick on paint or like window sills with paint peeling, they may eat the paint. So local authorities might be inspecting those buildings that are old using lead-based paints. Also, there used to be cars that used gas with lead in it, so there could be lead contaminated soil in the yard. These are some other sources if a child is playing outside and may possibly eat the soil. Also, glazed pottery, certain stained glass products, lead pipes that supply water to the home. Some parents may work at manufacturing companies that make batteries or cables, and those are sources of lead. There are certain folk remedies that may include the use of lead as a source of lead poisoning. Old painted toys or furniture are also a source that may cause lead poisoning. So the nurse does need to know these levels at a greater level than 45 micrograms per deciliter. Chelation therapy, either PO or IV, has to be administered. And chelation is a type of medication that removes metal in the blood. So greater than 70, the child will need to be hospitalized because that is quite a toxic number. So definitely chelation therapy and hospitalization is required, and lead is absolutely going to need intervention and removed from the home via the local health authorities. So nursing process includes screening questionnaire and a routine risk assessment, of course, assessing for those signs of anemia if able to detect, and asking the parent or caregiver if the home was built before the year or 1978 or earlier. So the staff will need to report to the public health agency if lead test is positive. And also, prevention of lead exposure will need to be educated. The caregiver may need to contact the landlord or owner, or the nurse may have to do that if the caregiver is not able to. So essentially, the landlord or owner is responsible to remove the lead paint. Typically, this is done via the public health system, so nurses aren't really, needing to reach out to anyone further, but to ensure that steps are beginning in place to remove the lead is essential.
Young children may ingest corrosives, which are strong acids or alkali products like bleach, drain cleaners, or detergents. Signs and symptoms of corrosive products include burning, pain in mouth, throat, and stomach, drooling, hemoptysis, agitation, edema of the tongue and lips, and also the pharynx. The Poison Control Center should be called immediately to address and guide treatment plans for the specific corrosive agent. Typically, their therapy includes just dilution with water or milk. Of course, ABCs are important, so maintain the airway, provide analgesics for comfort, and inducing vomiting is contraindicated. So many of the other drugs that may be given for ingestion that induce vomiting is contraindicated because the esophagus is so irritated from the corrosives. Overdosing with over-the-counter meds is very problematic, especially acetaminophen. This is the most common drug poison in children. Toxicity occurs at over 150 milligrams per kilogram if given that amount. Signs and symptoms are the following. Most concerning, though, is hepatic damage. So we are concerned about the liver when there is acetaminophen poisoning, and the treatment is mucomist. So there's quite a lot of doses that are needed. The loading dose is first given, it's 140 milligram per kilogram, and then additional 17 more doses of half that amount, 70 milligrams per kilogram at Q4 every hour. You don't need to know the dose, but how often it's given and how much is required is important. So again, Mucomyst for acetaminophen overdose, the most common drug poison in children, and it causes hepatic damage. And then there's aspirin. So toxicity begins in the acute phase at 150 milligrams per kilogram. Chronic poisoning is considered 2 days or more of aspirin overdose and is a lot more serious. So here are the signs and symptoms, and important to know that children can get into a coma or have seizures, so they may lose consciousness because of aspirin poisoning. So that's very, very life-threatening. Treatment for this is lavage or activated charcoal. Children may need to have dialysis if it's very severe, and also managing the symptoms are important, such as seizures and dehydration. So we have to pay close attention to safe range dose for the day versus a single dose on the bottle, and also child versus adult dose, and pay attention to weight-based dosing calculations, and these are important education topics as well for the parents. Oftentimes, it's hard to figure out what the child ingested, so understanding what the medications used for treatment does is important. So chelation therapy, that is used in lead, that it binds to metals in the blood and removes it. So Narcan is used to reverse respiratory depression. If the child is unconscious, then an opiate overdose is suspected, so immediately administer Narcan. Activated charcoal binds to chemicals in the bowel. Many medications can overdose of medications can be treated with activated charcoal except iron. Then there's polyethylene glycol or Marilax, and that cleans out the whole bowel, so just irrigation. Ipecac. So this syrup induces vomiting, and it's been kind of an old I guess practice where people used to have it in their house, and this is not recommended at all for home treatment to induce vomiting. So syrup of Ipecac is what it's called, and that induces vomiting. Again, like we talked about aspirin, some may require dialysis depending on how extensive the damage was to the organs. And then we treat any symptoms that may arise, such as seizure, or if there are thermoregulation alterations that occurred. And then some diagnostic tests that can be done. There's chemistry panel, ECG, liver function tests, or LFTs, especially for Tylenol or acetaminophen overdoses, since hepatic impairment is a big concern. Then there's urine and blood toxicology screens or specific drug levels if the substance ingested is known or highly suspected. So we'll talk a little bit more about the nursing process to patients with ingestion. We could spend all day talking about ADPI in regards to any topic, so we'll focus on the essentials. As far as assessments, the most important first step in the emergency treatment of poisoning is assessment. So rapid assessment is extremely important. The ABCs, airway, breathing, circulation, if rapid and incomplete, not thorough assessment is done, then there will be missed vital points that are not addressed. So rapid nursing assessment is crucial. If a normally healthy child, especially a young child, suddenly deteriorates without a known cause, definitely suspect a toxic ingestion. So diagnosis plan, implementation, so lots of teaching points. We want to teach the parent before anything happens. So as far as chemicals and medication, always, of course, lock anything and keep it out of reach. Take the child with you to answer the door when using chemicals or just stepping away from chemicals. I'll always make sure the child is with you. It just takes a second for the child to reach any container and start chugging. Never tell a child that medicine tastes as good as candy. Then they'll start to want it and perhaps grab it when you're not looking. Contact Poison Control with any questions, and here is a number for the National Poison Control Center. Make sure that's available on the fridge. Big teaching point for parents. Consistently use safety caps, and again, store poison substances in locked cabinets and or out of reach. Appendicitis is the acute inflammation of the appendix due to closed loop obstruction. It could be fecal matter or a foreign body that was ingested, causing pressure in the lumen of appendix, causing edema and compressed blood vessels. So complications of appendicitis would lead to a rupture if left untreated, or also known as perforation of the appendix. And this could lead to peritonitis. So when the fluids rupture from the appendix and spills out, this will cause infection in the stomach, yes, in the surrounding stomach cavity, abdominal cavity, or it might create an abscess locally. So some signs and symptoms, these include gradual, persistent, and intensifying pain in the right lower quadrant. So pain might be intermittent in different diagnosis. So if usually appendicitis is not it. It's always persistent and it gets worse and worse and worse. So it's not intermittent pain. Abdominal guarding may be seen. Perhaps the child is more comfortable side lying with the knees flexed. Those are all signs of appendicitis. Hypoactive bowel sounds, nausea, vomiting, frequent stooling, small stools, small volume stools, sorry. Low-grade fevers are common, and if there's a perforation, then high fever will occur. The child will appear ill. There will be tenderness when McBurney's point is palpated, and that's in the right lower quadrant as seen in this picture. And if peritonitis does occur when the rupture happens and the fluid leaks out into the abdominal cavity, there will be abdominal distension as well. So typically the child with appendicitis will need IV antibiotics, and if severe enough will require surgery. So appendicitis is the most leading emergent cause of surgery as far as any other diagnosis with abdominal pain for the child. Diagnostic tests include a CAT scan. Also, an ultrasound can detect appendicitis or a possible rupture. So either one will be sufficient to diagnose. An elevation in white blood cell if there's infection, and CRP or C-reactive protein may be elevated, and this indicates inflammation. So the nursing process, depending on surgery or pre-surgery or post-surgery, there's many things involved, including pain monitoring, pain control. For the child's greater than 3 years old, we use the Wong-Baker FACES scale. And so knowing the appropriate scale and assessment tool is important pre and post surgery, as far as and all the other things that is generally done, such as the GI assessment, the IV site inspection, and pain control. Again, here's the nursing process, and already some of the things we talked about, vital signs, especially after surgery and before surgery, in case there's a rise in temperature. And of course, one thing I didn't mention was an integumentary assessment, and addressing the wound and making sure there's no further infection in the wound bed. So some diagnoses for appendicitis include acute pain, risk for infection, and ineffective airway clearance. So after surgery, the child may be in a lot of pain and not understand deep breathing, turning, repositioning. So a lot of education has to go towards preventing pneumonia after surgery. Status post appendectomy. So we want to teach the child how to use a pillow to splint, encourage the child to blow bubbles, that helps expand the lungs, administer acetaminophen PRN for pain or possibly for fever. Chest physiotherapy may be done to help with airflow. Have the child lie in a semi-Fowler position after surgery. Left lying is also a good position for the child to avoid putting pressure on that right side. And then again, inspect wound and perform wound care. So now let's talk about autism spectrum disorder. The onset begins in infancy or early childhood and affects 1 in 68 children. Autism can range from mild to severe, and some severe cases requiring lifelong supervision. The exact etiology is unknown, although there are theories, but the exact cause of autism is not known. So to diagnose autism, it's typically involving impairment of social interactions and communication. That can include the inability to maintain eye contact, being socially non-interactive, delayed speech development, lack of spontaneous make-believe, and repetitive motor mannerisms. So a lot of social interactions to diagnose autism. There are currently no cure. However, there is medical therapy that aids behavior. So hyperactivity or aggressive behavior may be managed with medication, but there is no cure as of today to treat or cure autism. There are highly structured and intensive behavior modification programs that can help improve adaptive behavior. So these are highly, again, like good structured programs that modify behavior and helps with adapting to routines and environments. There's also complementary and alternative therapy, and those are researched as far as its effectiveness. So maybe some of you have seen or heard of like horseback riding or music therapy, sensory therapy, and things like that. So those are still being researched for autism. And the goal is for the child to reach optimal functioning within the disorder's limitations and providing emotional support and guidance for the parent. There are programs in the public schools that can be set up, and these are called IEP, and these are in conjunction with the PCP working with the school.